The Breakfast Show 2020 on KBC.
Repeat blood donors are better because they ensure a regular supply of blood and reduce the cost of and effort involved in trying to find first-time donors. But is it safe to keep donating blood?
Very safe. No side effects of donating blood. And that's why we ask, kindly donate. We might not have an upper age limit, as I was saying. The age limit we do. But 18 years or through to whatever age, if you are healthy, we'll get a pint of blood from you. Initially, I said when we need some, I would call it some sensitization to the clinicians in terms of what they want to use. If you want to use products, I said that is safer in terms of looking at the boundaries, the security, the commodity security for this brand. So it will be safer for us to have use in terms of the amounts when we are using brand products. This reduced use is number one. I said we have reduced number of people even seeking health. Even those that are very sick in this era, they are not coming to hospital. The COVID-19 era, we are having a lot of challenges since I think March or through to this December now. Reduced numbers of people coming to our facilities. Reduced number of people even accepting to, even those who are our usual donors, also reduced the numbers of those people who used to come and donate. So that alone is giving us that reduction. But the reduction is massive, is a massive reduction.
Right.
Yet we have clients who really require blood. Cancer patients, people who have blood cancers or blood diseases, abnormalities, they keep on requiring blood. People who are on dialysis keep on requiring blood.
Even pregnant women.
Pregnant women at times as during birth or whatever, keep on requiring blood. Yeah.
Morning, Julia. It's quite unfortunate that, and ironic that the government doesn't seem to get anything right. Unfortunately, you'll hear that the BBI will fix even this. We've always been on our own, and whether we donate blood or not, shida ni zile zile too. God help us.
I also equated to the donor apathy, and there's, of course, there's politics everywhere. Politics, they say, is the way of life. Now, we need to save lives. And I said blood is the only product you might not manufacture in laboratories. So we require people to come and donate. So save a life, leave the politics alone. You can at times say halt BBI, halt all those other systems that are halt even wherever, and come and donate. Save a life. The rest of the politics, even if you have BBI or no BBI, remember the life you have saved. So saving life is priority.
Okay. Is there thorough civic education that a donor goes through before they donate?
Of course, yes. We also make sure that we check several things. Number one, we'll check your hemoglobin levels. We'll check your number. I said your weight is paramount, your age. When is the last time you donated? There are several things we'll do. Our physical checks. We'll ask you several questions, including the tattoo one, because I know that's an issue. We'll ask you several questions. How do you get, are you exposed to whatever? So we look at the levels of exposure. Yeah, because several other diseases, you can be able to tell whether you had them in the past, future, or whatever. Several, yeah.
The Council of Governors Chairman, Wycliffe Oparanya, says blood collection is a sensitive unit and should be managed at the national level. He says most counties have been running blood drives, yet it is a national function. Do you share this sentiment?
I agree, and that's why I said for Nairobi, if we collect pints, we have to take them to the national office for what we call testing of the transfusion transmissible infections. We agree that's a national function. That's why we allow them to do this. But they can't use, so we use. So they'll screen for us, we will go and pick for use. We'll pick for use. Ours is use, theirs is screening.
So you just pick for use?
Yes. What we do is we complement the agenda about going to the field and getting the pints. We, like for Nairobi, we have given some technical staff to the National Blood Transfusion Center. We give them, we waive the grounds, you know, when they are doing donations, the ground where the tent is pitched, the county would wish to make a coin out of that. So we waive those grounds during, so we complement their activities, because we know even if they collect, it is for our use.
Right.
So it's a complementary agenda.
Nahashon, paint the picture for us what this means when the Kenya National Blood Transfusion Services, KNBTS, has been on strike for now the second month, and you know, there's blood collection and donation has gone down already even before COVID-19. What does this mean to the thousands of patients who need a transfusion?
When that happens, it's usually a sad state of affairs. Looking at the patient's life and the risk of losing the same or clients to lack of enough blood in their system, that's a big risk. But we've nothing much to do, because you remember those industry reactions are usually notified. They say we will do this because we are lacking this and this and this. So I might not be able to comment on several touchy issues, like why did they strike, why hasn't the government acted, why hasn't blah blah. So those are issues maybe either in court and they are waiting to get wherever. But it is the end product of a system failing. So we need to correct our systems so that we don't end up to the industrial actions. They are not good. Industrial actions are actually not good. It's good to limit them, get to know the cause.
The Kenya National Blood Transfusion Services is somehow disorganized because they are supposed to know how much blood used per year. Our question is the blood donated now safe during this COVID-19 pandemic?
COVID-19, number one, it's good to make it clear that COVID-19 is not transmitted via blood. We've not had issues, but COVID-19 is a blood transmissible infection. We know the mode of transmission for COVID-19. So maybe other than for other diseases, COVID-19, we are safe to donate and to use blood. But remember, we have to screen it for those other diseases, HIV, hepatitis, syphilis, all those other transmissible infections. But for COVID-19, we are safe and we are sure that we may not be able to transmit COVID-19 through blood. It has not been proven. In terms of stocking, remember I said there are several things that we do. Number one is donor mobilization, donor education. If people keep on coming to our sites, those I mentioned, the National Blood Donor and all those other sites for donation, then we'll have enough stocks. But many times you find that we have to keep on talking and trying to mobilize people to come and donate. So if they don't come and donate, then we don't get enough stocks. Yeah.
Hello, Julia. Ask our friend in studio why a whole level 5 hospital doesn't have a blood collection point and blood bank. 2018, I went to donate blood in Meru level 5 hospital and I left away feeling frustrated after being informed that they do not collect blood.
County governments are independent governments.
Yes.
I mean, the government of Nairobi Metropolitan Service, I might not know much about Meru, but what I know is, even in our facilities here in Nairobi, you refer the same question, even if it was in Mamarusi or Mbagathi or Pumwani, maybe the same could have occurred. Why? Systems are that in that point in time, we had policies that said only, and I like what the Council of Governors chair said, that it's a national issue. The blood collection is a national agenda. So we need to look at that, maybe do micro policies in the counties so that the county can be able now to run their own processes. Start with donation, screening and transfusion. If that doesn't occur, then we will still run to the errands of saying, I went to this facility and I was chased away because they had not, they were not fully prepared for me in terms of donating. Micro policies is a policy agenda.
Like Mama Lucy, for instance, if I have a patient there, I'm not able to donate blood from there.
The talks are in the high levels now. We already initiated this, that we will need to do brand and donations from 3 sites, extra sites in Nairobi. And we are soon starting this. Maybe we wanted to start this before the year ends, but I'm finding these are running. So we want to start donations from Mamarusi. We used to do, but the policy issue comes and then affects us. Then we have to refer. We've been referring patients to the National Blood Transfusion Services.
Yeah. So I'm asking so that we can get clarification that talks are at an advanced stage, like you said, but for now, it's
for now we still refer people to the National Blood Transfusion Center for donating.
So if you have family or someone you know at the hospital, you will go to the.
We send there.
Okay.
And that's the anomaly we are finding. It's odd. Yes. Somebody took some bus fare from home to Mamarusi, then from Mamarusi you send them to the National Blood Transfusion. That's an anomaly. We will collect that using a micro policy that will now dictate that we can donate blood in-house and then take to them for testing and then allow us to consume the pint if it's free of diseases.
Okay. Some hospitals are forced to discharge patients who are in urgent need of blood to seek health services in private hospitals from neighboring counties.
Still policy. And I'm saying that until we have a micro policy to guide the way brand drives are done and the way brand reaches back to the facilities for consumption or use or transfusion, then we'll still run that errand of back and forth and at times lack of the same because of policy says it has to be done wherever. And if you do against that, it's good. But we have private facilities who breed patients, and when they breed, they also screen, and I think at some point they also transfuse.
So what do you mean when you say who bleed patients?
Donate.
They donate, okay.
Yeah,
So do private hospitals usually get blood from the Kenya National Blood Transfusion Service, or do they acquire it commercially?
Personally, from my end, I know we don't have any boundaries to any hospital, either private, either mission, faith-based, or whatever. Anybody draws blood from the KNBTS. Even counties, we have no boundaries to counties.
Okay, another comment here from Stephen Oigo, who says we donate, they continue to sell. So this brings us back to the politics you talked about earlier. I mean, whether it is happening or not, I mean, it has an impact on blood donors. So what can be done to show them that it is the life that you're saving that's important?
Julia, as they are saying it, we need to ask ourselves, if there is not enough blood, where is that one which is sold gotten from? There's not enough for us to use. So where will we get that little to even sell?
But the thinking, Nahashon, is that we don't have because the one we have given has been sold.
So I get this. If going by that, I want to say that blood is a controlled item. It can be tracked. We can track who got what, because every pint is identifiable by, we have several systems of identifying a pint. We have a barcode, we have a serial number on the pint, and it can be tracked wherever it is, even to whoever was transfused with the pint. So that tracking system around makes people feel uncomfortable, because if you are transfused today, we'll know Julia was transfused with pint number this, the pilot number was this, and the barcode was this. Okay. So even if we want to follow, that's why we say, if the raw wants to take its course, you can follow all the pints and know who was transfused, or if they were not used, they were destroyed. That history is there.
What can you tell someone who's listening to the show, Nahashon, who has been weighing whether to, donate or not, given the politics and all these things going around? What would you tell that person, a potential blood donor? Donating
blood is cool. Come and donate blood. The other politics about whether it is sold or not, you donated to save a life. Kindly save a life. So number one I would to tell people is that, one, when we donate blood, we save a life. And I repeat the same, that blood cannot be manufactured in the laboratory. The cells, the plasma, all those other things can't be prepared in a laboratory. So we'll need people to come and donate. So I ask them, is some education, that people come, donate blood, we use it well, we'll screen it well, and they'll be able to save lives. Donating blood saves life.
There used to be this concern that when you go to donate blood, you would also be screened for maybe like HIV, and that used to make people, shy away, because maybe I don't want to donate blood, but I'm not ready to know my status. Has that been addressed?
Screening for blood for those diseases is a must, because we will not run the risk of transfusing you blood which was not screened.
No, the one that I'm donating.
You're donating. Yes. We have to screen that pint, because I'm saying we will not run the risk of getting a pint which is not now screened to give to a person when it's not screened. So we have to know the status of this pint. Now the status of the pint is the status of the individual who gave the pint. So at the end of it all, we know your status. But we have counselors.
Oh, you have counselors.
We have a counseling team. It's a total team. We have nurses, doctors, clinicians, lab techs. The brand, whatever, is a team. Yes, so we have a group of counselors who will take you through counseling in the case it becomes positive. And for HIV, we have no big wars. If it's positive, we have all the remedies, the treatment and the care we'll take. With management is there for HIV. Yes.
We've been speaking with the Nairobi County Lab Coordinator, Nahashon Marebe, who's given us insight on the state of blood donations in the county, because there's a shortage, not just in Nairobi, but throughout the country, where patients in dire need of transfusion are struggling to get blood. He's taken us through what you need to know as a blood donor. By the way, if you were thinking of getting a tattoo, maybe this... maybe this show, if nothing else, has showed you how that could give you complications in future. But thank you so much for your time and, of course, for your comments.
The Breakfast Show 2020 on KBC English Service.